them.
Well, maybe. Okay.
Alright, you guys ready?
All right.
Alright.
Do you have a
So,
plug-in for the phone?
shh, no.
No.
Thank you. Alright, so these are when to call the ambulance, and having such a close relationship with Jason, he has told us numerous stories of where people want them to, they'll call the firemen, they want to go up to the grocery store, they want to go, like they literally will call 911 and they just want to go get food. And so this is when you call an ambulance. So if you have someone who has bleeding that will not stop despite consistent pressure, no matter what you got going on, you hit something very valuable, it won't stop, that is an ambulance issue, and they need to call as soon as possible. If you have a patient that is unconscious, not breathing, if a patient is too hurt or unable to drive themselves to the ER, if a patient has been in a car accident or has any signs outwardly of a head injury, specifically one of the things you can look for with head injury is if your child falls and hits her head, you're going to look for one of two things. They're going to develop a goose egg and it's going to go out, or if it sinks in. So out is meaning it's swelling, you know, get you an ice pack. But if it goes in, that is an ambulance, and you absolutely got to get them as soon as you can.
I've never even heard of
Yeah.
a contusion going in.
Yes.
It's probably a broken skull. It's probably a broken skull.
It's probably a crack. So,
Yeah.
and so that's the thing is that instead of going out in that swelling, it means it's pushing inward.
And I know, like, if you get the head injury, like if one of your pupils changes size, that's a serious thing.
Okay, so if a patient has signs of stroke, seizure, or heart attack, because they are going to probably get worse, and they need to get to the ER anyway. If patients need the skills and equipment used by EMTs, one of the things with us doing preparedness and homesteading, there are some things that we as civilians cannot get that they can. And it's, you know, sometimes it's in the thousands of, dollars to buy that equipment, and they just have money for it. If a patient is not breathing, no matter what you do, if the patient has a bullet wound, if the patient has an asthma attack and there is no inhaler available, if the patient has second or third degree burns, and we're going to go over some infographics that will show you the differences between first, second, and third, and that way you'll be, it's actually so easy to tell the difference. And then finally, if your patient is having severe allergic respiratory response, if a child eats peanuts and they just have a couple of hives, those couple of hives can go from that to, mommy, I can't swallow, I can't breathe, real quick. And for allergic situations, you need an EpiPen to stop an anaphylactic attack, and that is not something they hand out. I have to have one, and it is a $500 pen, and insurance does not pay.
And even if you use the EpiPen, that's just to buy you time until you get to the hospital.
Yeah, and as someone who's had one, they made me do a breathing treatment, they shoved Benadryl down, I mean, it's a whole thing. And you have needles all in you, so it is an ER visit. Alright, so this is abrasions. Basically, it's a superficial injury. The only concern when it comes to abrasions, everybody's had one. If you've ever ridden a bike or a skateboard, everybody's had one. But the concern is if it's a large area and it has gravel or any kind of foreign matter. It's not an ER thing, but it is a crucial care. Because you have to have someone who is higher trained look at that and go, okay, yeah, we definitely need to get that gravel out, and they have to clean it out. And so that is, it's not an ER thing though. And that's, with Jason, one of the concerns that they see happening is that frequently Americans are told, well, if you have, if you're just sick, if you just have a common cold, go to the ER. That causes immense congestion when you could be treating it at home or go to a crucial care.
Yeah, no, I had that experience. Last week, her sister, she was just laying on the bed like this, and her sister just grabbed her arm to pull her up to snuggle, and nursemaids all about.
Yeah.
Both the urgent cares in Palaca were closed. I had to take her to the ER, and I was like,
And that's the thing, it's my job.
that's it. It was just a rotation. She just went back there. The nurse said, "Can I see your elbow?" She
Yeah, just flip it back
Flip,
into
pop.
place and good to go.
20 minutes later, she said, "Can we go?" It's
Yeah.
like, baby, we gotta wait to be discharged. We can't
Yeah.
just.
Now there are 3 crucial cares though in Palatka. You just gotta find all 3.
I know there's St. John's. I know there's that one urgent care. I don't know the.
Yeah, I can't remember the other one, but there's 1 ER for the whole area and 3 crucial care, and you get the care you get. I'll leave it at that. Alright, so a puncture wound. Now this one depends, because a puncture wound will go from I stepped on a tack on the floor versus I got stabbed. And so when you have something deeply embedded into your body, if you try to pull it out, you could literally bleed out. And so you absolutely, if it is something big like just a chunk of metal, a knife, a screwdriver, leave it in, wrap gauze around it, and get yourself to the ER if it is deep enough.
My son stepped on a roofing nail.
Ooh.
Oh gosh. Yeah. And that's it's not even the puncture wound necessarily that's the concern, it is secondary infection. Because when you see that streaking line coming out of that wound, you're like, that's the ER visit. Because that's usually going to be IV fluids. Let's see here. Alright, so lacerations are pretty common in childhood. They get them a lot. They don't need to be treated in the ER. This is, again, crucial care, mom care. Shouldn't be a big deal. However, if you get something that is incredibly large, there's a lot of redness, and again, secondary infection, that is, get them to the crucial care or ER. And one of the good things about crucial care is if you get in there and they know they can't fix you, they will get you to where you need to be. So that's kind of nice. This will hopefully be up on the Facebook page, by the way. So this is for a choking child. Infant is obviously different than a bigger child. Infant, you flip them upside down, put your fingers in a V shape, and you just do a couple of back blows. Parents frequently have this tendency, and I've seen it multiple times, of grabbing their kids' arms, and I don't know where this stems from, but grabbing their arms and literally lifting them up and shaking them like a doll, like, or pounding on their back, like you're not helping. You might be worsening. Yeah. And the child is like already struggling as it is, and then by the way, they're being beat. So what you're looking for is they are unable to cough. They are completely silent. No air, no crying, no speaking. With infants and toddlers, their fingertips, their lips will change color. As once that oxygen is affected, it is a big deal. You can tell. With the older child, again, you're gonna do back blows. You can just put them over your leg, and you're going to continue trying to get that up as much as possible. As someone who swallowed a coin as a child, sometimes whatever they have swallowed, instead of it going down, it will lodge and it can sit right in the dead smack middle, and so they can breathe through, but they still feel it. So they have to actually do, they have to take you to the ER. You have to go to the ER, and they put the child under, and they will pull it out with forceps, and it's a whole lot of money. It was not fun in any way. Obviously, a choking adult, you're going to change up a little bit. It's going to be frequent coughing, inability to breathe or talk. They're going to grab, they're going to gesture, they're going to try and get to you. Hey, I cannot get air up. So the Heimlich maneuver is performed, has to be done immediately. If it's done right, you really shouldn't need to go to crucial care or ER. The problem, the foreign object is out. They may still cough afterwards because when you have something where it's not supposed to be, your body will overproduce mucus to try to shove that out. So you basically stand behind the victim, wrap your arms around the person, apply pressure to the bottom of the diaphragm, and you just kind of pull upright. And it's actually not difficult. You have so much adrenaline going through you. I had to do it on my mom a couple of times, and you just had no idea how much adrenaline you have until your family member's life is in danger. It's crazy. I lifted her off the floor in my effort to dislodge it. But yeah, so that's it's something that everybody needs to know. And just so that you know, we do have a specific first aid CPR AED class that we have with everyone, where you come in, we have a dummy on the table and you do chest compressions, and they're going to actually, you know, help you do that. This, however, is just first aid more than anything. So first aid for a first degree burn is very, very minor stuff. Everybody's had them, especially if you cooked.
I've got one right now.
Yeah. In fact, a sunburn is considered a first degree burn. So you basically just have the outermost layer of damage, causes redness, pain, dryness without. That is the key. There is no blisters. That is a first degree crucial care, treat at home kind of thing. However, if the burn is on an infant or a toddler, if it is in a large area, you need to at least call your doctor and say, hey, do I need to go to crucial? Do I need to go to ER? It's this big. Some doctors, you can actually take a picture of the child's wound and send it to them. And that's great, but not every doctor obviously has that service. But yeah, so that is the first degree burn. The causes of these are also important to know, because this is how you're able to decide which degree it is. So the causes of first degree is you touched a hot object or surface, hot liquids, flames, but it can include chemical or radiative, which is sunburn. So that's your first degree. And I'll have a picture after the third degree description. So the second degree burn is going to be much deeper. It's characterized this time by blisters, redness, swelling, severe pain, and skin that actually appears shiny because you've lost fluid in your skin. So the recommendation is you're going to apply water to 15 to 20 minutes to reduce the pain and the swelling. Do not pop the blisters once they form. If you do that, it is one of the most incredibly painful things.
It is.
I learned that personally.
It hurts.
It is not, yeah. All right, so you are looking to keep in your first aid kit an OTC burn cream. They're the best stuff, and I think I put it on here, is down at the end. It's called Silvadene cream. It's got a really long hoo-hoo name for it, but basically it's on a Silvadene cream. If you can get that, that is like cream gold. You can use it on so many wounds. So it's called Silvadene cream, but it is a prescription. So the next time you get a burn, maybe consider calling your doctor and saying, hey, would you be willing to write me a prescription? I got a burn. I'd like this Silvadene cream.
And use aloe?
Huh?
And use aloe? For burns? Aloe?
Oh, definitely.
Aloe
It
is-
needs to be as genuine as possible. I bought some that claimed to be genuine
Yeah.
from Walmart, and it just like didn't do anything. We got some from, I think it's called Lily of the Valley.
From the plant.
Yeah, straight from the
Yeah.
plant if you can.
You can get it straight from the plant.
But
and
not everyone has fresh
But
aloe.
when you go up to the levels of damage, or like first degree, you can do aloe on it and you'll probably be okay. But the more damage, when blisters come into place, and with children, you want to stop that. I had a friend of mine who had some coffee carafes, and she was doing coffee for church service, and she made the mistake of putting her toddler in his toddler seat and the carafes underneath his feet. And so when she closed the door and she comes around, she's getting in, he let out this ungodly scream. He was just in such pain. And what had happened is he pushed down on the carafe and it sprayed hot boiling coffee on his leg. And so in that moment, you want to stop